Hi, welcome to Tips and Tricks, where I try to give you some useful information in under 2 minutes. So we're talking about handling difficult patients and difficult cases, but I think one of the most important things you can do when you're handling patients that really need comprehensive treatment, full mouth reconstructions or something close to that, is don't get started too soon. You really need multiple appointments to really work that patient up properly, and you really need to get to know that patient. So we run our patients through pretty much the same protocol. We have about 4 appointment protocols. Obviously, the first appointment, we're getting to meet the patient and kind of setting up diagnosis. We have our diagnosis, data collection, x-rays and photos and stuff like that. Second appointment, and then we do a comprehensive exam and analysis, and where I get to know the patient really well and talk to them and show them the pictures and talk about the different possibilities for their treatment. And then the third appointment, once they accept treatment, then we would get into the planning phase. And my daughter likes to call it, my daughter is Dr. Crispin. She's also a dentist here, anesthetic professional, and she calls it dating the patient. And I think with any good relationship, you really need to get to know that patient. Are they going to show up on time for their appointments? Are they going to complain about every little fee that you charge? Because if they're complaining about fees for x-rays and study models, wait till they get the bill for all the crowns and bridges and veneers that you're hoping to do on them. Are they treating your patients? Are they treating your staff with respect? Are they treating you with respect? And I think that, if in fact the patients aren't complying, I just confront them and say, you're not being compliant, and if you want me to treat you, you have to be compliant. So you either become a good patient, I don't tell them this, but you either become a good patient or maybe I would not want to treat them. So anyway, date your patients before you start anything that's irreversible, because once you start prepping those teeth, you're kind of stuck. So be careful treating that demanding and sometimes difficult patient. Thank you.